Alright, so I'm going to be making some videos for the nursing program, and this is going to be my study tool. I'm not sure if I'll ever post them or if they'll help anyone else, but I'm hoping they help me pass my exams. So first I'm going to talk about fluids and electrolytes, and the first video is going to be about the fluids. So there's a couple different kinds. The first one is intracellular, or ICF, and this is found inside the cell. It accounts for 2/3 of the fluids, and the solutes found within it are mostly oxygen, electrolytes, and glucose. The major cation or electrolyte is potassium and magnesium, and then the major anion, which is also an electrolyte, is phosphate and sulfate. Next we have extracellular fluids, or ECF, and this is known as like the transport system. So first we have intravascular, which is within the circulatory system, also known as plasma, and it's very protein rich because of the albumin. Then we have the interstitial, which is around and in between the cells. And then we have transcellular, which includes cerebrospinal, pericardial, pancreatic, pleural, intraocular, biliary, peritoneal, and synovial fluids. And then we also have lymph. The primary electrolytes in the ECF are sodium chloride, which follows sodium, and bicarbonate. Smaller amounts are potassium, calcium, and magnesium, but they're not as prevalent. And then we have third spacing. So this is extracellular body spaces in which fluid can accumulate. It's useless. It cannot transport anything, and it's not a reserve fluid, it's just there. The common sites are tissue spaces, which is what we call edema. In the abdomen, it's called ascites. In pleural spaces, it's called pleural effusion, and then in pericardial spaces, it's called pericardial effusion. The causes could be injury or inflammation, such as massive trauma, crash injuries, burns, cancer, sepsis, and these all increase the vascular permeability that allows fluid to leak out. And then there is malnutrition or liver dysfunction. So causes could be starvation, cirrhosis, or chronic alcoholism. So this prevents the liver from producing albumin, which is lowering the capillary oncotic pressure. And then lastly, another cause is high vascular hydrostatic pressure. Could be heart failure, could be renal failure, it could be another form of vascular fluid overload. It pushes abnormal volumes of fluid from vessels. So that's leading to the third spacing fluids. So that is that.